Hi, you're listening to Talk 1260 KTRC Western Medicine, a show about plastic surgery with me, Dr. Daniel Ronel, board-certified plastic surgeon. And it's okay, Betsy Ronel. Oh, good, Les is here. Our next guest is here. We've just been talking about mommy makeovers, and we're going to continue this,
in this
discussion
vein.
a little bit, talking about expectations.
Right.
What were you saying?
We all have preconceived, I mean, I know this from I can only base this off my personal experience, that's all I know. And my personal experience, being the wife of a doctor, coming from a medical background in terms of my family, everyone in my family except my mother and I are doctors. So you'd think I would know something about this kind of thing. And it turns out, I watch the shows like the rest of us. I have my own ideas of what I wish I looked like.
We talk about it every night.
Right, and you know, it amazed me. I walked into that surgery without even realizing. I was unaware of these preconceived notions I had in my head of what I expected my boobs to look like when I came out. And they do. They look fantastic, and I'm quite pleased. Of what I expected my healing to look like, my scars to look like. Just, you know, I had all kinds of stuff I didn't even know until the bandages came off and I started healing. And the scars don't come out hair thin, hairline thin or whatever at first. They look a little awkward at first. And what's funny is a lot of women, including myself, get hysterical. Oh my God, am I going to be deformed? Am I going to look like this for the rest of my life? What have you done? You know, and it's funny. The last surgery I had was a year ago.
Right.
The scars, one scar still doesn't look great.
Right.
But it's still in the process of healing.
It can take 2 years.
Exactly,
Right.
at least sometimes, and
Right.
even thereafter, it can change.
Right. And how many times did I operate on you?
Right, you've operated on my boobs 3 times. You've revised the scars. Actually, I think 3 times, not 2 times. I think I said before 2 times.
Yeah. The point is that, I mean, of all the people who I would operate on with the best intentions, it would be my wife, and even that way, you need a revision.
Life happens, right?
Right,
I mean,
right.
The surgeon can only do so much. Their cuts, their initial incisions, of course, are a hairline because
Right,
you
they
see
look
the
perfect.
blade,
Right.
right? And the minute you come out of the surgery, the very first day you see yourself, you see that the scars are beautiful and that everything's just right and everything's looking good. But then your body takes over, and your life takes over, and you might sleep on one side, and you might, you know, hold your baby on one side, you know. There's all kinds of stuff that goes into the healing equation.
So the point is, I try to counsel my patients on what to expect.
Right.
And I always tell them it's really hard to predict. I can say most people are going to be happy, and this is what most people are going to look like after a week, after
I don't
2
like
weeks.
the most people thing, you know that? Because he's...
But it doesn't matter.
Yeah,
Right.
he's done, we'll talk about this in another thing, but he's done a liquid lift on my face, and most people, the filler lasts from, what, 1 to 3 years, or whatever they say?
Not on you.
Oh no, not on me. And I guarantee you I am not the only woman. And I was infuriated a few months ago after the pain I had to go through and just the swelling and whatever. It's uncomfortable. Some women don't mind. I personally mind. I have to go in after hours and I yowl, I curse at him, I threaten to divorce him a number of times. I can't stand
You have
it.
to clear the staff out
Right.
of my
I
office.
mean, I go in there after literally like 8 o'clock at night, and, you know, whatever. But because it's so unbelievably painful to me.
For you.
For me,
some
right.
people it's
And
not.
the funny thing is, I have a high threshold for pain, but not in my face. There's so many nerve endings in your face. Even with all the anesthesia he puts in my skin and the numbing cream and everything, I'm still like, you know, I'm gonna kill him.
I mean, this is the reality. If
Right.
you come to my office, I'll tell you, and my office manager will tell you, no, it doesn't really hurt. Or some people, it hurts some people, you need to take Valium. If you talk to her, she's going to say, oh my God, it's the
But the
most
thing
painful
is,
thing I've done.
right, and I'm not a hysterical person. What I would say is, how's your threshold for pain? It just doesn't hurt to try and calm yourself down if you don't know, if there's an unknown factor there, or if you might be hysterical. Who knows? Who cares? Take one, you know, Valium or one Xanax. The doctor will prescribe an appropriate dose for you. It'll give you one single pill, and you'll go in there, and you'll be very, you know.
Yeah, I mean, the reality is,
yeah.
I
That's what I
obviously,
do.
I've never, you know, I don't know about childbirth, but what my patients say, you know, when I see them a year later, is they say, God, you know, I'm so sorry that I complained so much after the surgery because I really don't remember it now.
Right.
Boy, it was just like childbirth. you
Like,
know.
I'm ready to
I
go
don't
get my
remember.
cheeks injected again. I could care less. I remember that I was very angry about the pain and my husband, but yet I have forgotten the essence of it. It's like childbirth. You know it was uncomfortable. Of course, please. An 8-pound child coming out of something this big, give me a break. You know, but whatever. I don't know. You forget it and you go on. Somewhere in your head you remember, but you know what you're in for the next time.
So the point is that, you know, everybody's got reality, everybody's got an image when they go in to get a procedure of plastic surgery, and
of what they expect to look like when they come out.
You just need to be open-minded, that's all.
Right.
Okay, you're listening to Dr. Daniel Ronel talking on Western Medicine, show about plastic surgery on Talk 1260 KTRC.
That was good.
All right, Les is here. Let's have him come in.
Okay. Where's Shop? Bring in the third chair. What if I have a question
Well, you want to
as a layperson?
Hey, Les.
I'm the layperson
Thank
here.
you for coming.
So Gina, was that okay or
That
what?
was good. You guys are doing a lot better.
Good. I'm always all right. I'm trying to talk less. The last time I talked so much is because the guy was half dead. So I was overcompensating.
Have you met Betsy?